Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Ha-cha-cha, here I am with no Dr. Gwen having a show about AI to take the place of Dr. Gwen, but I need some audience participation here on the Auburn Medical Group YouTube program. I have the titles here, but of course Dr. Gwen's out. Just to let you know, I also will be out next week, and then we'll be back together following that. But to talk about AI, do you guys know about AI? This experience of having a robot able to converse with you. There's a couple of them out there. There's two that we'll be looking at today. One from Google called Bard, B-A-R-D, and another one called ChatGPT from OpenAI. And we'll work with both of them, and we'll be looking at them from a perspective of healthcare. You know, could this thing replace your doctor? I think that's the title of our show today. Could it replace your doctor? So let's go ahead and go to the chat and see that already Lindsay is, well, look at this. Lindsay is giving us something to go to ChatGPT with. So let me change over so you can see what's going on the computer as I'm talking to ChatGPT. We'll start with that one, and then we'll use Bard after that. So with ChatGPT, I asked it a question earlier, and here it is. I asked it, can you diagnose illness? And it came back with, as an artificial intelligence language model, I am not capable of diagnosing illnesses or providing medical advice. Only licensed medical professionals with access to your medical history and physical examinations can diagnose illnesses and provide appropriate treatment plans. If you're experiencing symptoms or have concerns about your health, it is best to seek the advice of a qualified medical professional. Boy, I couldn't have said it better. Let's see what Bard says in answer to the question, can you diagnose illness? And Bard comes back with, I am a large language model, also known as conversational AI or chatbot, trained to be informative and comprehensive. I am trained on a massive amount of text data and am able to communicate with and generate human-like text in response to a wide range of prompts and questions. For example, I can provide summaries of factual topics or create stories. I'm not able to diagnose illness. I'm not a medical professional, and I do not have the training or expertise to diagnose medical conditions. If you are concerned about your health, I recommend that you seek professional medical care. And absolutely, that's what we would recommend at this point anyway in the technology that we have available with these robots that with AI can do amazing things, but they're being used. They're being used all sorts of industries. They're being used by programmers to write code in languages they're not all that familiar with, or to write sections of it. They're being used by doctors to write consult notes. They tell there's a little prompt here. I'll show it to you again. A little prompt down. Can you see the cursor? There's a cursor there. A little prompt down here. It says, enter a prompt here. And you give it some information, and it takes that information and forms something. So you could put this, just kind of say the things that you want to make sure are unique to that patient's note, and what you came up with as far as a diagnosis, recommended treatment. If you're a consultant, sending a note back to the doctor who sent the patient to you. And ChatGPT or Bard will write the letter or the note for you to send back to the doctor in a very neat letter. It's kind of like having, I guess, a secretary who would take just the essential bits of information that aren't the same from letter to letter and then make a custom letter for you. It's pretty neat. So we're going to use it today. I think I'm going to be able to copy and paste what Lindsay gave us. Let's go back to the chat. Here's Lindsay's symptoms. So we'll give it a try here. I have Bard ready to go, and I have to get Lindsay's symptoms and copy them into. So she says, oh, she's got another, I'm sorry, there's another message from Lindsay after this one. So we'll copy this one to start with. Sharp pain in upper right abdomen, nausea. So as a doctor, I'm thinking of a few things that could be going on here. It's not letting me copy it, so I'll just type it right in for us. So, let me see. Did you say right upper quadrant or right upper abdomen? Sharp pain in right abdomen nausea. Sharp pain in right. So I have an idea what this is going to turn out to be already. We'll see what the computer comes up. Nausea. Except the doctor can't spell nausea. And then on the other little entry, she put disoriented thoughts, fever, headache. Now, that doesn't go so much with what I was thinking. Disoriented thoughts, fever, headache. Disoriented thoughts, fever. And what was the last thing there? I'll look it up. Because I can look it up for you guys to be able to type it. And headache. So I'm just kind of writing these out. I'll show you. I'm writing them out here, and you can see it listed here at the bottom of the screen. This one is Google's Bard. And so let me do something with that. So there's a list of symptoms. I am having these symptoms, period. Which follow-up question, I'll make that plural. Would a doctor ask to try to diagnose the cause of these symptoms? So that'd be a way to put it, right? So we'll hit enter and see what we get there. Well, I'll go ahead and show you what it looks like as it's running. So you can see that there's a little diamond thing spinning there as the information is being processed, and very quick. Oh, okay. Here are some follow-up questions a doctor might try or might ask to try to diagnose the cause of your symptoms. How long have you been experiencing the symptoms? What makes the pain worse? What makes the pain better? Have you had any changes in your bowel habits? Have you had any changes in your urine habits? Have you had any changes in your appetite, and your weight, energy level, and your mood, and your skin, and your vision, and your hearing, your balance, coordination, reflexes, sensation, motor function, thinking, memory, language, speech, swallowing, coughing, sneezing, breathing, heart rate, blood pressure, pulse, temperature, skin color, hair color, eye color. What? You're okay. So it asks some things that no, I would never ask about ear color. No, skin color, yeah. But specific to the ears, no, I would not ask that. And I don't know if that's because I'm missing something as an experienced clinician who would, go over these symptoms if a patient came in with them, or if maybe the chat is a little funny on it. So let me copy this and see where we get with the same list or same exact question, if I can copy it, and take it into what was the other one called? OpenAI, ChatGPT. Here we go. So I'm ready to paste it into the little lower line here. And I'm going to hit enter. And let's see what happens here. Oh my goodness, it's already going. Let me show you. It's fast. So if you're experiencing sharp pain in the right upper abdomen, nausea, disoriented thoughts, fever, and headache, a doctor may ask you the following follow-up questions to help diagnose the cause of your symptoms. How long have you been experiencing these symptoms? How have you experienced these symptoms before? And if so, how often? Does the pain in your abdomen radiate to any other parts of your body? I like this one better. As a doctor, this sounds a lot more like where I'm going to be going. This is the ChatGPT by OpenAI. Let's continue here. Notice any changes in your bowel movements or urine output? Have you been exposed to any new foods, medications, or substances recently? Have you traveled recently or been in contact with anyone who's been sick? Have you experienced any other symptoms such as vomiting, diarrhea, difficulty breathing? Do you have any pre-existing medical conditions or take any medications regularly? Do you have any allergies to medications or foods? Are you experiencing any other unusual concerning symptoms? These questions will help the doctor better understand your symptoms and develop an appropriate diagnosis and treatment plan. So I would say, why don't we just see if possibly Lindsay's come up with some follow-up for us here that we can use. These are supposed to be two separate symptom clusters, LOL. Thanks for letting me know that in time to not put them all together. So let's go heavily with the right upper quadrant and nausea, since we started with that. Laura Barzyk also is chiming in here with that she says, I have quite a few comorbidities. Would the system be able to differentiate between that when typing the symptoms? Let's do that, Laura. Write some of your, if you're comfortable with this, write some of your comorbidities, and we'll make our patient that's a conglomerate of all of us have your comorbidities and Lindsay's acute symptoms, and we'll see what kind of process it goes through in coming up with an idea. And I'll tell you what I'm thinking ahead of time here, and that's that this could probably be a valuable tool for me. I'll tell you what I'm thinking back to. I'm thinking back to the days before we had anything but a blank piece of paper when we saw a patient. This was in the emergency department years ago, just a blank piece of paper, early 2000s. Nothing on it. And there was a company that specifically made pre-formatted sheets. It was about 4 pages in size for emergency departments. And there was I don't remember, 20 to 30 of these sheets that you would have in like a brochure display, so you could select the one that was appropriate for your patient. And it had really broad things like chest pain or abdominal pain or fever. And it would have sets of questions for you to ask. And I remember one of my fellow emergency physicians talking about using one when he moonlighted at another emergency department. And he said a patient came in with a real rapid heart rate, and he didn't think to ask about decongestant medicines, if the patient had taken any decongestant medicines, which could be a cause of that, but was prompted by this sheet. And so that was kind of 20-something years ago, a predecessor to what ChatGPT seems to be able to provide us. Just that little, hey, did you think about, or hey, what about, just something that might slip your mind if you're just depending on memory alone and not having some kind of a guide or a reference that's appropriate for whatever the chief complaint that is that the patient's having. All right, so let's go back to our both our chat and our. So let me bring back up the chat. You can see that Laura Barzyk is saying, okay, let's go with ulcerative colitis, high blood pressure, hypothyroidism, fibromyalgia, essential tremors, Raynaud's phenomenon, and cervical dystonia. So let's put all of that in. And when she says cervical, she's referring to the neck having a spasm in the muscles. Okay, so I'm going to copy that. If it'll let me. Oh, please let me. Please let me copy. All right. Control, copy. Let's see. And I'll go to chat. I'll show you what I'm doing here. Chat GPT. And I'll say, see if it took it. Control. Yes. Are my underlying medical conditions. Okay, so this is a combination of Laura Barzyk's medical history or pre-existing conditions and Lindsay Antwine's chief complaint, upper abdominal pain and nausea. Of course, we also got the headache and other things, but we'll see if it can go ahead and do it anyway. So let me take you back to it, the browser here. Thank you for sharing your underlying medical conditions. If you're experiencing sharp pain in the right abdomen, nausea, disoriented thoughts, fever, and headache, it is important to seek medical attention as soon as possible, especially given your history of ulcerative colitis and other conditions. That's a good answer. The doctor may need to perform a physical examination and run some tests. Oh, okay, this is where it's going to be fun. Let's see what tests the computer is suggesting. So I'll tell you up front what I would be considering. Okay, I'm going to consider getting a comprehensive metabolic panel, maybe specifically a liver panel that has some tests would be separate from that, a complete blood count, a urine, and probably an ultrasound. If I was in the emergency department, this was an acute pain, absolutely I'd be doing that. I'd be getting vital signs. Boy, it's still going. I'll show you what it's doing. It's really going. So the doctor may perform a physical examination, run some tests to determine the cause of your symptoms, may also need to review your medical history and medications to ensure the prescribed treatment is safe and effective for you, given your underlying conditions. You know, I mentioned before about medicines that have been taken. Sometimes that is very pertinent to what's going on acutely when you're working with a problem. All right, back to the browser. In the case of ulcerative colitis, some of the symptoms you're experiencing, such as abdominal pain, nausea, and fever, could be indicative of a flare-up. Could be. However, other potential causes, such as infection or other underlying medical condition, would also need to be ruled out. Therefore, it is important to speak with a medical professional as soon as possible to determine if the cause of your symptoms and develop an appropriate treatment plan that takes your underlying medical conditions into account. I'm going to give our fictional patient here a little more detail. I'm going to say it's a 40-year-old female who has had 2 babies, and their last period was 3 weeks ago. Okay, we'll just put that in here. So let's see. You're watching this. Okay, I am a 40-year-old female. Boy, this is as much fun as catfishing, isn't it? 40-year-old. Let's see, 40-year-old female. That's nice. A 40-year-old female. My last period was 3 weeks ago. No, let's make it 2 weeks. It was 2 weeks ago. And what else did I say? 40-year-old female, my last period was 2 weeks ago. I don't have a fever. And my vital signs are normal. Let's try that. Let's see what that gets us. Thank you for providing this information. If you are a 40-year-old female who has her period 2 weeks ago and is not experiencing fever or abnormal vital signs, it is possible that your symptoms may be related to other factors. There are several possible causes of abdominal pain and discomfort, such as indigestion, constipation, urinary tract infections, ovarian cysts, and even stress. However, without additional information, it is difficult to determine the exact cause of your symptoms. And I notice it's not saying anything about gallbladder, which is kind of the top of the list of things you would think of here. If your symptoms persist or worsen, it is important to seek medical attention from a healthcare professional. They may need to perform a physical exam and run some tests. It's also worth noting that if you experience any unusual or concerning symptoms, such as heavy bleeding or severe abdominal pain, you should seek medical attention immediately. Okay, I love this because it's actually doing the things you'd want a triage nurse to make sure they get out there. Those very important signs and symptoms that if they occur, absolutely, they need to get to the emergency department without hesitation. Stop messing around with the Chat-GPT or on the phone with an advice person. So I like that it's got kind of these things built in already that you would want to have there. Now, we know we're going to see things that are just off, kind of like the ear color change. But that was on the other one. That was Bard. That wasn't Chat-GPT. Okay, so let's ask it specifically which tests, okay? Imaging and blood tests. So I'm going to put in here which imaging and lab tests, it's not just blood, there's a urine test too, tests would likely be used to help determine the cause of the symptoms. Wouldn't this be great if I always hit the right keys? Okay, there we go. Let's see what it says. Specific imaging and laboratory tests used to help determine the cause of abdominal pain and other related symptoms may vary depending on the individual's medical history, physical examination presenting symptoms. Here are some common tests may be ordered. Blood tests. So it puts in the complete blood count, the liver function test that we talked about earlier, urine test, yeah. Stool tests. Ooh, yeah. I wasn't, I probably wouldn't actually try to get for one thing, it's hard to get when you're working and it doesn't contribute that much. Imaging tests, ultrasound, CT scan, MRI. Okay, because you're looking at cysts, kidney stones, inflammation of the GI tract. A pelvic exam, yes, absolutely. There's kind of the saying in emergency medicine, if the patient is able to have children, meaning they have periods, they're not well, even if they haven't had their first period yet, you need to be considering it, all the way up to menopausal, or just say if they have a uterus, and the pain is, the way we used to say is between the nipples and the knees. If there's pain anywhere in between, they get a pelvic exam. And that's a very good rule. It's a bit extreme and almost all encompassing, but it makes you realize, oh, wait a minute, pain can radiate to lots of places, And it can be related to something that you would discover on a pelvic examination with female patient. Male patient, you don't have that that available, because there's a lot of information not just related to the genital tract, but even other things, because the way you do a pelvic exam and have your fingers inside of the patient, you actually can get information you can't get on male patients. You can tell when things are coming from behind the vaginal area. You can tell when things are coming from in front of it. You can get a feel for if a mass, when you're doing the abdominal exam and pushing around, you feel something there. You can get a feel for where that is relative to other organs. You can kind of tell how large the uterus is. You can tell because of where your fingers are in the exam and you're checking, you can tell where the ovaries are and if they're enlarged. If they're attached to something they shouldn't be, like a cancer growing. So that's why pelvic exams are so much a part of abdominal pain evaluations. And even the right upper quadrant abdominal pain, you go, that's nowhere near the uterus. Why are you doing a pelvic exam if the patient's pain is way up near their ribs? I'll tell you why. Because every once in a while, you'll do that exam and you'll find a discharge that goes with pelvic inflammatory disease from usually it comes from something like gonorrhea or chlamydia, most likely gonorrhea. And it's causing the pain in the right upper quadrant because it's actually an irritation of the liver. That's the first thing that the patient notices, that this inflammation that's coming from the cervical area, well, it's all over the place, but that's what's going to give you the diagnosis. So that's why we go all the way from the diaphragm down, and then they say to the knees. Well, that's because a lot of things can actually have a pain that radiates to the groin area, and some patients will actually interpret that as past the groin and down in the thighs, just because of the way nerves work. So a lot to it. Let's get to your comments, because I've been going on and on and on without you guys. So let's see what the comments are from you, the viewers who are watching this live while we're doing the show. And Laura threw in that she also has the vertigo, and Lindsay said, to be clear, I'm not having these symptoms. I'm just volunteering because, yeah, I know, Lindsay, asking for a friend. We've all been there. Thank you. So let's say we order some tests. Let's give the computer what the results are. So let's say my CBC was normal except for a mild anemia, not too uncommon in somebody who's having periods. That's not an unusual thing at all. Mild anemia. The urine showed elevated urobilinogen. The creatinine, there it is. Creatinine was mildly elevated. Otherwise, oh no, we need to put in something else. Do I want to go with the indirect or the direct bilirubin was elevated? Let me think this for a moment. We'll say total. The total bilirubin was elevated. The direct bilirubin was, I always have to think this through, sorry. The direct bilirubin was, let's trying to think, okay, so it's the indirect before it's processed by the liver, and then when it's processed by the liver, it's direct. Okay, so it's coming through the liver fine, so it's the direct that's elevated. Yeah, okay, I already have it written that way. And on ultrasound, I feel like I kind of took over Lindsay and Laura's condition here. On ultrasound, there were stones in the gallbladder. There we go. What's ChatGPT got to say about that? Okay, so thank you. The results suggest that you may have gallstones, which can cause abdominal pain and discomfort, as well as elevate liver function tests. Elevated urobilinogen and the bilirubin levels may indicate a problem with liver function, which can be caused by gallstones obstructing the flow of bile from the gallbladder. The mildly elevated creatinine level may also indicate that the kidneys are not functioning at their optimal level, which can be a result of several underlying conditions, maybe unrelated. It's also important to follow up with your healthcare provider to discuss the results of your tests and any necessary treatment options, depending on the severity of symptoms and the size and location of the gallstones. Your health may recommend surgical removal of the gallbladder or other interventions to manage your symptoms. In the meantime, you can try to manage your symptoms. Whoa, it's giving some advice here. By following a low-fat diet, staying hydrated, and avoiding triggers that may exacerbate your symptoms. It's also important to avoid over-the-counter pain relievers, as they can worsen gallbladder symptoms. Okay. I'm trying to, I'm a little embarrassed here that it's catching me here. I'm playing catch up to the computer. So I think it's not talking about Tylenol. It could be talking about non-steroidal anti-inflammatory medicines, and not talking about opiates that are often used for gallbladder pain. Interesting, because we actually get good relief with actually over-the-counter pain relievers. So yeah, I didn't rehearse this. All right, should we try the Bard with some of this and see what we get? So we'll go over to Bard, and so it was asking a lot of questions, but I didn't like its questions as much because it wasn't asking questions along the lines of, well, what was it I really liked about the other one? It was there's something I really liked back here. Yeah, asking about radiation of the pain. Have you had it before? How long has it been going on? It's talking about exposure to food, so some real historical stuff, not so much asking about just the symptoms or other related symptoms, what we call a review of systems. It's asking about things that may have caused it, while still asking about related symptoms, but it's much more focused than the Bard was. So we'll get back to Bard here, and we'll see what kind of tests might be ordered by a doctor. And what I'm looking for is something that might actually be useful clinically to myself right now without even getting this technology further developed, as far as like that reference I was talking about where it reminds you, oh, maybe you should think about also getting blah, blah, blah in your workup for this patient. Okay, let's go back to it. The doctor might order a number of tests, including blood tests, urine tests, imaging tests, endoscopy. Ooh, we didn't get that from either myself or from ChatGPT. Surgery, this may be necessary to cause. So it's kind of a more broad sort of way of talking about it. I really feel like the ChatGPT is, if I was to say there's a winner between these two, just in this one single, very limited trial, that's the one I'd like. So let me just go to the chat real quickly and see if you guys had any follow-up questions here as we're kind of coming to the end of our Dr. Chatbot. So the chat, yeah, we're on the chat. Okay. Lindsay says the AI advice is go see a doctor. Yes, it is. And then Laura says, I can't take NSAIDs because of an internal pouch that was created when my colon was removed. Okay. And Miguel Yu, MD. Okay. Ask ChatGPT why analgesics will worsen gallbladder symptoms. It will give you an answer. Oh, Dr. Yu coming to the rescue so we'll ask ChatGPT that very thing. Let's see, let me bring it up here so you guys can see as I ask it. Why would NSAIDs, so this is referring to those anti-inflammatory medicines like ibuprofen, why would NSAIDs aggravate gallbladder pain? Now, I noticed it said aggravate gallbladder stones when I was typing it in instead of gallbladder pain. And so I wonder if it's more of a factor of the formation of the problem, the stones, rather than acutely aggravating the pain while you're having it. Let's find out. Maybe Dr. Yu would like to even pipe in on that. What happened here? I think I hit delete instead of, okay. Why would, let's see what we're talking. Why would use of NSAIDs aggravate gallstone? We'll just say we'll just go with what it's asking. Okay, why? Oh. What's going on here? Oh, it answered it. Okay. NSAIDs, by inhibiting the production of prostaglandins, which are hormone-like substances that help protect the lining of the stomach and intestines. Okay, so what we're talking about here is a stomach issue, not a gallbladder issue. Coming back to it here. I'll show you where I'm reading here. When prostaglandin production is decreased, it can cause the stomach and intestinal line to become more vulnerable to damage, leading to inflammation and irritation. In the case of gallbladder pain, NSAIDs can worsen symptoms by causing gallbladder to contract more forcefully, which can lead to increased pain and discomfort. And additionally, NSAIDs can increase the risk of bleeding in the digestive tract, which can be dangerous in cases where the gallbladder is already inflamed or infected. For this reason, it is generally recommended to avoid using NSAIDs if you're experiencing gallbladder pain or have a history of gallbladder problems. Instead, your healthcare provider may recommend alternative pain relievers or interventions. And then it gives the same information a second time here. Okay, so let's go back and see if Dr. Yu also had anything else to throw in there. That was helpful. Thank you, Dr. Yu. We appreciate that. And okay, so looking at the chat, we don't have anything additional on there. So interestingly, there are some NSAIDs, Toradol, for example, that's given usually by injection that has in the past enjoyed a reputation of actually being a helpful pain reliever for either kidney stones or gallstones. But oftentimes in an emergency department setting where somebody's got acute pain from the gallbladder, it's very normal to go straight to opiates in that setting. You'll notice that this is the guy who is very averse to prescribing opiates in the outpatient setting. I recognize they are very valuable in the acute care setting, in the emergency department when somebody's actively having something that they would go to the emergency department for, quite often something that may require a surgical solution. So thank you. That was really good. Thank you, Lindsay and Laura Barzyk, for participating. Thank you also to Miguel Yu, MD. Thank you for throwing in your 2 cents worth there. That was helpful too. And I hope you guys all enjoyed this. We will be back with Dr. Gwen in 2 weeks. I don't guarantee that we'll have a show next week because Dr. Gwen will be here without me and he doesn't do shows on his own. But we do especially appreciate people like Lindsay Antwine, who participates in Patreon. We'll have a thing up here in just a moment where you can see how you also can participate in Patreon if you think that'd be fun. Until next time, Dr. Mark Vaughn telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.